When I was taking pharmacology, I talked to a student who had taken the class before me, and she said she really didn't understand the textbook. And I think the terms that she was having trouble with were the side effects and conditions that are mentioned in the book. And the book mostly sort of assumes that you know what these terms mean. And when we took medical terminology, we were taught, each of the parts of putting together these words. And so here's just a quick review of some of those breakdowns so that you can start to pick up on new terms by knowing more of the terms and side effects and conditions that are in the pharmacology text. Will help you later on in your career, I think, to be able to pick apart new words that you might be unfamiliar with because of these parts would just repeat themselves, since most medical terminology comes from Latin and Greek bases. So first, let's talk about terms that deal with blood. So emia is going to mean blood, and glyce is sugar, and hyper is overly. So hyperglycemia is having too much sugar in your blood. Hyper, just like a hyperactive kid, is too active. The next word is thrombocyto. Thrombocytopenia. And thrombo is a blood clot. Cyto is cell. And penia is going to be deficiency. So it's not actually a blood clot cell deficiency. Well, I mean, I guess sort of it is. It's actually a platelet deficiency. So platelets being the parts in the blood that allow your blood to clot. Leukopenia. Leuco means white, and again, penia means deficiency. Is going to be a lack of white blood cells. Anemia is going to be literally translated to without blood. But it really refers to a lack of red blood cells. And then we have this one I had never seen before, blood dyscrasia. Dys meaning abnormal, and it refers to a disorder of the cellular elements in the blood. So it's an abnormal collection, so to speak, of cells in your blood. So parts of your blood that are sort of abnormal. So it could be like a tumor of the blood cells that's making too many or something. That term actually seems to come up quite a bit in the pharmacology text. Then neutropenia. And again, penia is going to be deficiency. Neutro is going to, in this case, refer to neutrophils, which are a type of white blood cells. And then hemophilia. At this point, you've probably taken some of the Surg Tech classes if you're in pharmacology already, and hemo is going to be referring to blood, just like hemostasis refers to trying to keep the blood in the patient's body, and philia means loving, just like hydrophilic is a water-loving. Hemophilia literally translates to blood-loving, but it actually is a condition of the blood where you don't clot well, and so when you get cut, your blood just sort of pours out of your body unhindered by clotting. So small injuries are going to bleed a lot. Agranulocytosis A meaning without. Granulo is granular. Cyto is cell. And osis is condition. And this is going to be a lack of granulocytes, which are a type of white blood cell in the body. Hematochezia is going to be blood in the stool, and so the hemat is blood, and that's all that I know how to translate literally there for you. So that one's going to be blood in the stool. And then, so now let's talk about conditions related to bone. So osteomalacia is going to be bone softening. Osteoporosis is going to be bone density decrease. And a couple of terms for breathing that come up in the pharmacology text. Bronchospasm, that one comes up in the surgical tech book several times as well. So bronchospasm. Broncho is going to be the bronchioles, which are the tubes that tie into your lungs from your trachea, so these guys here. And then a spasm is going to be a contraction. A pulmonary fibrosis pulmonary is going to be another term for lung or air. And fibrosis, osis, is going to be a condition. And fiber, I guess, is going to be a fibrous condition. So it's a fibrous condition of the lungs. You guys may have heard of apnea. Apnea is going to be, actually it's, apnea is going to be breathing. A is going to be without. So sleep apnea is when you stop breathing while you're sleeping. And then dyspnea is going to be having trouble breathing, because dys we already discussed is abnormal. And pnea is breathing. So then tachypnea. Tachy means fast. We discussed this in Surg Tech when we talk about tachycardia, which is a fast heart rate. So in this case, tachypnea is going to be fast breathing. And then let's talk about some terms for drugs. So let me scroll back over here. So a anti-neoplastic drug. Anti is going to be against. A neoplasm, if you've read the cancer terms chapter, is going to be a tumor. Or if you break it down literally, neo means new and plastic means formation. So then an antipyretic is going to be against fever and a antiemetic is going to be against. Any guesses on emetic? Does emesis ring a bell? If you've taken lab, emesis is the kidney-shaped basin, so that is used for vomiting, so this is an anti-vomiting drug. An analgesic, this one's going to come up in Surg Tech class a lot. So, an meaning without, and algia is going to be pain. So this is a pain reliever. And an anesthetic is going to be without, and aesthesia is going to be sensation. Then we can talk about